Hello, Mr. Finlay. I am Dr. Kanika, and this is my colleague Arunima Kaul. We welcome you to Afro Asia MHA Summit 2020-21. I'd like to introduce Mr. Finlay to everybody else. Mr. Finlay is a Cameroonian native residing in the United States of America. He's a social activist, project consultant, and development facilitator with experience working with US, Africa, and international non-profit organizations. He is founder and director for Community Development Network, a non-profit organization addressing social challenges in Cameroon and 501(c)(3 in the United States. He is currently pursuing his PhD in organization leadership and holds a master's in social policy. And he is also a certified family centered coach working with underprivileged communities in the USA. Sir, we are very honored to have you on board with us.
Thank you very much. It's my pleasure to be a part of this summit, and I'm really excited to be, joining you all and sharing my own skills, knowledge, and experience. So I thank you again very much for this opportunity.
Thank you so much, sir. Sir, now my colleague would be, asking some questions from you. Over to you, Arunima.
Hello, sir. A very warm welcome to you.
Thank you.
So we have a few list of questions for you. So let's start with the first question. Sir, please shed some light about the overall situation in Cameroon with relation to access of education and engagement in MHM as opposed to other African countries.
I would say today the knowledge that I know of Cameroon with relation to education and menstrual hygiene management, it's not very different from what you would find in a lot of African countries because from some research that I've done and my understanding of what's going on in other African countries, it kind of cuts across the line what is happening. We kind of experience the same challenges. There's access to resources, not enough access to resources. There's lack of information. There is some cultural, underlining that affects the way, girls manage their menstruation. There's also not enough funds to be able to, purchase menstrual material to be able to manage their period. So I would say the situation today in Cameroon is the same as in most African countries. The only difference I'll try to point out is when you look at the statistics in general of, how many girls are affected on a whole when it comes to MHM and their education in Africa, I would say the number is higher in Cameroon because many girls are affected by this during that month. Girls would miss, I would say, up to 3 days of school in a month, whereas it's not probably the same in other African countries, but the challenges are equally the same for them.
Okay, sir. Thank you, sir.
Sir,
Over to
so
you,
moving
Kanika.
on. Yes. Sir, so moving on, our next question to you is what are the core challenges that you see or face in the country with relation to period poverty and any steps that your organization, which is Community Development Network, or maybe your country has taken on a policy level to address those issues?
Now, like I was saying earlier, some of the core challenges, first of all, there's the issue of, gender inequality. When we talk of period management or menstrual hygiene management, we always tend to focus and look at it as something that only associates with the woman, which to me, I disagree because over the years, my involvement with my organization and working in schools and communities and trying to promote, and empower young girls, I saw that even women themselves were surprised that a man was involved in the whole talk. And I didn't understand why, because if we're trying to promote and empower the woman so that she has a say and so that she can fully function in society without any bias, without any prejudice, or looked as an equal person in the society, then the man too needs to work with her to support the men need to be on board. So there's that issue of inequality that I say plays a great part. And the second one I would like to talk about is the cost of menstrual products. They're a little bit expensive, especially when you look at rural parts of Cameroon. Some people can't afford them, and families would tend to prioritize other things over, getting these hygiene products for their girls and the rest. So it leaves them in a position where they won't be able to manage that the right way. And you see that in some cases they end up, managing it in a poor way, using leaves, using some kind of cloths and cotton and things like that, which just puts their hygiene and sanitation in a very, delicate situation. Thirdly, I would mention the fact that it's not widely spoken. It's kind of considered, MHM in Cameroon is kind of considered like it's something that should not be talked about in public. I don't see why I can't, sit at work or sit in school and be able to talk with friends, be they guys or be they girls, about what are some of the challenges they face. Because for you to be able to support someone, for you to be able to educate, for you to be able to understand, you need to be able to talk, you need to be able to communicate. There is that core challenge, freely talking about it in the open, asking questions, being curious, and being able to understand. Because if you don't understand, then it's hard for you to even do anything with it. Now, coming back to Community Development Network, one of the things we've done, we focus mainly in our activities and projects on education and health. So MHM kind of blends the two things that we focus on. And the way we wanted to do it, I thought it was easier that we approach MHM in the form of creating forums of discussion. When I say forums of discussion, we've been to schools, we've been to communities. For us to be able to support these communities, to support families, to support girls, we need to be able to engage with them. We need to be able to talk with them. That's the first thing that we started with. And we've had a lot of these forums where we go to schools and we bring as many girls as possible into one place and we say, let's talk. What is it that you don't talk about? What is it that you would like to know that you don't even ask your own friends, that you don't even ask your parents, you don't even ask, your teacher, you don't even ask the doctor? Let's break that silence. Let's make it a forum where there's no judgment, there's nobody being shy or being scared, and let's just talk about it. I found it really interesting because sometimes when I was in that hall, in that space, nobody would talk. And when I would walk out of that space, they would talk. But strangely, when they would talk and they would bring up some of those questions, and I walked back into space and I would answer them, and I would ask them questions and they would answer me. I would ask them, why is there that disconnect? Why don't you talk when I'm here? And someone told me one day, because you're a man, you don't understand this. I said, but I'm here because I want to understand. I am part of that whole support system. For me to be able to work with you, I need to be able to understand what are the challenges you face. So that's one of the things that we've done, created that forum, meet with young girls, meet with parents, involve teachers, bring as many people as possible in one place just to say, this is something we need to do. This is something we need to talk about. And we take it from there. We do a series of, open discussions and do follow-ups. And when we identify certain of these challenges, then we try to figure out what would be the best line of action and try to work with other organizations too to make this happen.
So I totally agree with you on the fact that a lot of people in India also are not able to afford the sanitary pads or maybe the other products for the menstruation. So I really appreciate the fact that you said that you want to be a part of it and you want to understand. Being a man, you want to understand the pain that women and girls are going through, And I really appreciate what your organization is doing for the women and little girls.
Thank you very much. Just to add to that, I I think, and this is just something that came to my mind when you were talking. It's not just working with an organization. It's not just working with young girls. It's everyone, because a woman or a young girl is part of a community. She's part of a country. She's part of a family. So why does she have to deal with something by herself? Now, I'll share with you an experience, and this is where I had the whole curiosity and interest about menstrual hygiene management on its own. I was visiting this very small rural area back in Cameroon, and I was so curious that and surprised that day. It was during the day about 10 a.m. And at this time, normally every, school age kid should be in school or in class. But there was a group of young girls, just sitting around in the corner, and they were just talking. And it was my first time in that community. So I was just trying to understand what are people doing here? Is this like a place where young girls meet to talk, or is there something? And one of them told me we didn't go to school today. And I was like, why? I thought everyone is in school, because I saw most people in school that day, because I went by the school, and they said, no, we cannot go to school. I said, why not? And one of them just said, no, you cannot understand. We cannot go to school today. And there was two of them who could not go because, they were going through that period of the month. And the other two others could not go because their parents couldn't afford it. So it was easier for me to understand the other two who could not go to school because their parents couldn't afford. But for the other two, they wouldn't tell me why. And I later on asked some questions to like some elders in that community to understand what they said. No, they don't go to school if they don't, they're having their period. That really, I never really thought of that, because I had sisters growing up. Strangely, they went to school when they had their period because they could manage it well. They had pads and everything, but it's back a question in my head. So some people would not go to school when they are in their period. Why is that? Okay, there's certain things that I didn't understand, and I started asking all these questions. And the more I asked, the more I understood, and the more I got interested in wanting to be a part of it. Not just by myself, but I thought as an organization, it makes sense to work with others to bring as many people together, and also to share that with my own fellow friends. I mean, with men, with colleagues, I'll talk about, menstruation. Not that I know. Someone has told me before, you don't feel what they feel. You don't know that. I said, but if I put myself in their mindset for a second, I can only imagine. And I wouldn't be able to shame someone, or I wouldn't be able to tell someone you can't eat with me because you're bleeding, or you can't do this, or you can't do that, because I wouldn't want anyone to do that to me. So if you put yourself just for a second in their mind, in a girl's mind, then I want to believe that I know what it feels like, even though I've never experienced it for real. I just thought I'd share that with you all.
Great, sir. Not everybody understands the situation what girls go through, especially that's why the mindset has been created among people.
I
So,
agree with
sir,
you.
yeah, yeah, totally. So, sir, my next question to you is, so you already talked about your organization, Community Development Network, and what it primarily do. So, sir, can you tell me some of the challenges that you face and some of your success stories or some of the programs that you run?
Some of the challenges that we've faced, mainly it's been not having access to certain communities or schools to run some of these workshops. To me, that would be a major challenge that we've had, because like I said earlier, there's not that understanding, there's not that equal or open access to information. Because when you want to go into a community, you need to you need to request for permission or a school. But in most cases, you get turned down, or you wait and wait and wait, and you never get a response, which I think shouldn't be the case. I think we should be welcome all the time. The door should be open, and everyone should jump on the opportunity of, an organization or a group coming in to educate girls and empower girls. So we've had that in some communities and schools. We've even had a pushback like, no, we don't want you to come talk to girls about that. So that has been one. Successes, I would say, would be the opposite of that. We've been to very remote communities where we've talked with girls, we've enlightened them, we've empowered them. We've started small discussion groups in these communities with girls who, we follow up with them, and they've been able to do a 360. They're able to get up in the morning and smile, and even if they're going through that period of the month, you wouldn't be able to tell, because they get up in the morning and they face that day for what it is, not because they're having their period. So I think that's one thing that we can be very proud of today. It's not just been one girl, it's not been one community. We've been to a lot of them. We've been to a lot of schools. We've shared a lot of menstrual hygiene products. We've shared a lot of sanitary products to these schools. We would have workshop with these girls. We've had, different organizations from around the world donate hygiene supplies to us, which we've taken to some of these areas. We shared it to these girls. We've had reusable ones, we've had disposable ones, and we've seen how it has played an important role in these girls' lives, in these communities, in these families. So those to us are major successes. And I think as we move forward, we keep, picking on some of the challenges and finding ways to overcome them and just turn them into successes.
So it was a great success story. And lastly, I was just wanted to ask you, what are your future objectives or goals for your organization?
Future objectives and goals. There's a lot of them. I don't know where to start, but I would try to summarize them. From As the name itself says, Community Development Network. That's a name that took me probably a long time to, put together, because in my mind, I didn't just think of an organization that's doing one thing. I wanted to think of an organization that's working with others. We're not just one entity, and that's the same thing I was sharing with someone yesterday. I said organizations tend to work by themselves. We don't need to do that. We are a network. You might specialize in something, but you want to work with another organization that does something probably linked to what you're doing. That said, the way forward for Community Development Network is, I want to think of bigger collaborations. I want to think of working with Toto Afrika. I want to think of working with organizations in India, not because we're in the same place, but because we're advocating for the same thing. We're trying to promote and empower girls in our communities, and, cutting across borders and exchanging and creating forums like this, having these kind of summits. Why not have one in Cameroon? Why not bring together these schools? Why not bring together girls? So for me, I'm thinking in the future of, creating bigger forums where people and organizations can collaborate and exchange ideas, so that we can make better impact in the community and projects that we're doing. The second one would be partnering with schools and communities. It's easy, or it's different when you go to them and you try to, get access just because you want to do a workshop or you want to do a discussion group and you want to share supplies and do other activities in them. But partnering with them, partnering with schools, partnering with communities is also giving them some kind of a responsibility. Not just saying, I want to come in today as an organization and do this, but saying, we want to work with you because you are there, and this is what you can do after we leave or before we get there or while we're there. Partnering with them and giving them a responsibility so that they themselves can be fueling these actions, because we cannot be everywhere at the same time. But if we partner with these organizations and these schools, we're spread everywhere. while they're there, they can do the work and we can follow up and, continue pushing with them. One other thing that I'm looking forward to doing is possibly working with, some organizations, or seeing ways of mobilizing, as much resource as possible in terms of sanitary material or sanitary products for girls. A lot of young girls, a lot of women still don't have access to that or cannot afford it. So one of the things I'm really thinking for the future is how to possibly put sanitary material in the hands of those who cannot have it as much as possible and as frequent as possible, so that they don't have that challenge. I've been talking to a few organizations and I'm still trying to see which would be the best way: reusable materials over probably disposable ones, but also seeing how practical that would be, how efficient it would be to, get to that level and supply and provide it at no cost to these girls in these areas. So those are some of those things for the future that I'm thinking about. If I keep going, I think I have really crazy and wild ideas all the time, but these are the ones that really come to the top of my mind that I think would help set a lot of things going for the future. And that's only relating to, the MHM project, of course.
That's great, sir. I wish all your goals come accomplish really, really soon as possible.
Thank you very much.
So I would like to conclude this session by thanking Mr. Finlay to be a part of our event. It was a wonderful session with you, sir. We are looking forward to more such associations with you in the coming future. You're most welcome to Toto Africa anytime you want.
Awesome. Thank you very much.
Thank you and best of luck for your work ahead in the community network, development network.
Thank you very much, Sil. Thank you.
Also, thank you everyone for joining in this session. And also don't forget to like, share and follow us and Community Development Network to know more about us. Thank you.